Upstate Medical University in Syracuse, New York invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. We've seen news coverage of airline passengers flipping out on flight attendants, teachers who are assaulted in the classroom, healthcare workers who are attacked in the course of caring for patients. With incidents of violent, disrespectful, and disruptive behavior on the rise, Upstate leaders are responding. Here to explain how are Frank Ferrante and Jerry Santoferrara. They're both workplace violence coordinators at Upstate. Welcome to the Informed Patient, Mr. Ferrante and Mr. Santoferrara.
Thank you for having us.
Yes, thank you.
Let's talk about what Respect and Heal is. Mr. Santoferrara, can you explain how it came together?
Sure. Respect and Heal is a collaborative effort of leaders from the hospitals and health systems across Central New York. Its aim is at ensuring the safe and respectful treatment of healthcare workers, including support from the Onondaga District Attorney William Fitzpatrick. Part of the platform actually addresses federal and state legislation that provides more penalties for those who knowingly and intentionally assault or intimidate hospital employees. And then in the words of Dr. Corona himself regarding the major themes, all staff will be treated with respect, that there will be zero tolerance policy of any threat, and that any violence against frontline staff will be met with the full enforcement of the law.
The Dr. Corona that you've mentioned is Dr. Robert Corona. He's the Chief Executive Officer for Upstate University Hospital. So when we say zero tolerance, what does that mean? What happens to a patient or their family member if they start getting pushy with staff?
Well, it's most important that our first intervention would always be to attempt to de-escalate, but to echo what Jerry was referring to with Dr. Corona's statement is that the violence is still not going to be tolerated. That we encourage our staff to, if they feel that they're unsafe or if they are in danger, we are fortunate we have our UPD and public safety, and you leverage their resources. From there can be police reports filed, charges pressed, and applies to both patients and visitors. Workplace violence is a significant issue in healthcare, which refers right back to Respect and Heal and the involvement of the DA in addressing federal and state legislation to levy more penalties. Our staff do not come to work to get hurt. They're here to provide high-level patient quality care, and it's not going to be tolerated to be assaulted.
Do you think the fact that multiple health organizations are banding together for a Respect and Heal campaign when these are, normally competitors, do you think that that signals this is a really important issue?
Yes, absolutely. But the situation you described is truly not limited to Upstate. It's a nationwide crisis. The collaboration of other organizations and the support from our district attorney really does represent a monumental step toward raising awareness and implementing essential changes to really enhance the safety of staff and everyone involved within the institution.
Do you have a feel for how many healthcare workers have been harmed on the job recently or how severe the injuries have been?
Upstate does closely monitor the data to identify high-risk areas. So far, we've been able to suss out the emergency department and psych units where violence is most prevalent. Notably, nurses bear the brunt of these incidents, wide range of severity. To provide comprehensive support, though, we do offer resources that address physical, emotional, and cognitive needs. The resources for these include, but are not limited to, our social worker, Lauren Angelo. She's a staff support social worker, specifically for instances of these sort of violent or aggressive approaches to assist with employee management and sort of being a liaison to other services, along with our employee assistance program, which aims to bridge the gap as well for necessary care.
Well, Mr. Ferrante, looking beyond the person who gets injured on the job, let's lay out why this is a bigger issue than the threat of individual harm. Because I'm thinking about it's got to be really difficult for a doctor or a nurse or a technician to function. Just even to think straight if they're worried about being attacked.
And it's a justifiable right when you're considering that this is a national issue. That's why one of the things we are emphasizing is really for staff at this point is that situational awareness. Upstate has made it a focus to ensure that employees are provided a safe environment by addressing issues in real time and supporting staff. Healthcare providers, they can be task oriented, and it is essential that they take their time to familiarize themselves with their surroundings and positioning. This can sometimes be overlooked or challenging given the level of patient care required. But as healthcare workers, our primary focus is providing care, but we should also remember to take those necessary measures when appropriate to keep themselves safe and as safe as possible. While we must always keep in mind that the only behavior we can ever control is our own.
That's true. So let me ask you if you can describe your role at Upstate. You're both, I know, workplace violence coordinators, but what do you do?
So, as workplace violence coordinators, we're responsible for running the data to identify trends in violent activity, along with developing interventions within interdisciplinary teams to reduce the risk of violence against staff. So, basically, we review each reported assault and we meet with our mitigation committee weekly, comprised of providers, nursing leaders, nurse managers, ethics, and many others, to optimize care of the patient to assure that their needs are met while also reducing the risk to the staff. We also conduct rounds throughout the institution, assessing units for environmental risks, as well as getting essential feedback from the frontline staff regarding their concerns and perspectives. So we try to make sure that we're a visible presence and as supportive as we can possibly be.
Is there training or lessons to be taught that can help a healthcare providers stay safe?
And currently, the hospital does offer, there is CPI, which is crisis prevention intervention. There's CISM, which is crisis incident stress management. And they're all various levels of identifying risk and how do you manage them on a variety of different levels. We are looking into what are those other opportunities. That's that feedback we're getting to see if there is additional training to be more specific to units with the issues that they're actually encountering.
Let me ask you, because we know this is happening nationwide, what is it that's making people more aggressive these days? Do you have some ideas?
So as far as ideas are concerned about this, it's definitely challenging because people have speculated maybe some COVID fatigue and challenges with longer wait times, short staffing, issues that maybe aren't necessarily a direct result of COVID, but things that have sort of contributed to bogging down of some of the systems. And so being able to understand that, however, at the same time, firmly stand by our policy here and not tolerate disrespect and unsafe behaviors, we can have a sort of holistic approach in as being able to validate and understand frustrations with some individuals and how care has maybe been impacted. But we're struggling as far as the violence, right? Like we're not condoning that, but understanding holistically that there are more things at play and frustrations, and it's just not easy.
People maybe have complaints about having to wait a long time because we're short-staffed or something along those lines. Do you find that explaining that to them helps or not?
Some people do understand and they're very, very patient. And then others not so much. It's a tough thing to kind of field, really. Because you see people kind of feel bad for, and the patients will say, oh, I didn't want to bother the nurses. I feel bad because I see how busy people are. And so it really just depends on the person and their level of sort of awareness and their tolerance and their patience.
Well, it didn't used to be this way, so it gives me hope that we'll get back to what it was like before people started sort of freaking out. So it's encouraging to know that you are working on Respect and Heal, and we'll see what that does. Thank you both so much for making time for this interview.
Thank you, Amber. Really appreciate it.
Yes, no problem. We appreciate it.
My guests have been Frank Ferrante and Jerry Santoferrara. They're both workplace violence coordinators at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.